Welcome, everyone. My name is Phyllis Schrag, and I'm here to support Scott Heidepriem. I want him to be our next governor. We are women supporting Scott Heidepriem. Every woman in South Dakota is a working woman. She either works inside the home or outside the home, and most often both. Some South Dakota women work 2 and 3 jobs just to make ends meet. I know gifted, very intelligent women who, like a CEO in a large corporation, manage the family business or the business arm of their farm or ranch. They daily, without a day off, do all the household things and chores outside the home, some even milking cows. They come in, lay out a hearty, healthy breakfast for their families, race to the shower, and run to their menial, low-paying job in a town nearby just to keep the family financially afloat. These women like me are frustrated to see South Dakota money, sometimes millions of dollars, go to pipelines rather than education. These women like me think it's wrong that the greatest asset, our children, continually have underfunded education when money has been allocated for that very purpose. These women like me think it's wrong that it's not just local K-12 education that's suffering, but it's also higher education. These women like me are angry because their beloved grandchildren are hours and states away because their own children cannot get decent, good-paying jobs in South Dakota. These women like me know firsthand the abject poverty in our reservations and our small and large towns in South Dakota. They know that for most divorced women, they will immediately be placed in poverty because their income is cut in half and because good-paying jobs are not available to them. Women make a difference, as they have made a difference for 90 years. A whole lifetime ago, women before us picketed the White House for the right to vote. Some were beaten and chained to cell bars with their hands high over their head, hanging there for the night, bleeding and gasping for air. Some went on hunger strikes only to be force-fed. Some were thought insane because they insisted they had the right to vote. Courage in women was often mistaken for insanity. Women today in South Dakota stand on the shoulders of these courageous political pioneers. To not vote is to deny their sacrifices. And so courageous women in South Dakota need to vote for Scott Heidepriem because we are not satisfied with the way things have been and the way they would continue if his opponent wins. Courageous women in South Dakota need to vote for Scott Heidepriem because a deep, philosophical, proactive change must be made if our situations and those of our children and grandchildren are to improve. Courageous South Dakota women need to vote for Scott Heidepriem because we, the choosy women, sisters, aunts, mothers, grandmothers, and great-grandmothers of South Dakota have thought deeply and carefully about our future. We are ready for a real difference. We will vote for Scott Heidepriem, and today we will highlight the reasons Scott Heidepriem must be our next governor. And our first speaker will be Susie Blake.
Thank you. Good morning. My name is Susie Blake. I have been a nurse for nearly 40 years. I have served in a variety of healthcare settings, from drug and alcohol prevention to clinical to hospitals. I have watched as healthcare has grown into an unsustainable burden to our nation, and it has become a privilege, dividing the haves and the have-nots. I believe healthcare is a right for everyone, and for that reason, Scott Heidepriem is my choice for governor. I had the privilege of serving with Scott in the legislature this past session, and I know he is committed to making sure that South Dakota continues to provide the highest quality of care it now offers, but also that care is provided to all South Dakotans. He has said he will not pursue the lawsuit that this administration has filed, using dollars that are badly needed and could be used elsewhere, but would remove access to care for many South Dakotans, children with pre-existing conditions, coverage for young adults under the age of 26, and those with limited financial resources. He understands and he's open to new ideas and models that are currently being used in other states. Payment bundling, medical home model, outcome-based medicine, all programs that are showing a positive impact on the costs and quality of care with federal dollars help. He's willing to work with our medical school officials and other healthcare providers to make certain that we are using our resources to continue to train young minds to be able to provide enough healthcare workers for quality coverage for our entire state. He understands the principles of prevention, which are so important in healthcare and have not been endorsed by the current administration. They've tried to eliminate the Birth to 3 Connections program, which serves our most vulnerable and youngest citizens, and saves the state an enormous amount of money if it can be in special education needs, if it can be provided before elementary school. They have scoffed at early brain research, which has shown undisputably time and time again a savings of $7 to $11 for every dollar spent on pre-K education. They've tried to eliminate the state autism program several times at a time when autism spectrum disorders are reaching epidemic proportions. These programs were saved only through a groundswell of grassroots support, parents, teachers, providers. For these and many other reasons, we need a new type of leader, one who is willing and capable to take us in a forward direction, one who's willing to invest in education, prevention, and making sure we have quality health care for all South Dakotans. We need someone who is fiscally responsible and has a vision for South Dakota's future. We need Senator Scott Heidepriem. Thank you.
And now we will hear from Kate Parker.
This should be interesting.
Do you want me to take him?
Oh, no, he's good.
Sure.
Yes. Listen. I've heard people argue that preparing children for kindergarten is the responsibility of the parents, specifically mothers. Well, we've already heard today that many mothers work inside and outside the home. While I agree that parents are key to a child's success in school, I believe these people are obviously out of touch with the lives of South Dakotans. South Dakota has one of the highest percentages of households where both parents work. What that says is that more and more children are in daycare settings prior to starting kindergarten. And these children, especially in rural communities, don't have the access to preschools that better prepare all children for kindergarten. We're very lucky here in Sioux Falls. We have many great preschool programs, but they're not accessible to everybody. It is essential that we establish pre-K standards so that all children are prepared for their first day of kindergarten. Is that right?
Yeah.
Yes.
Are we going to have a stand?
As a school board member, I am alarmed at the decrease in state funds going to K-12 education. Over the past 8 years, state funding has decreased from 39% to 31% as part of the budget. Education is an investment in the future of South Dakota, and Scott Heidepriem is a firm believer of that investment. As for the Birth to 3 program, my oldest, not this guy here, is a graduate of the Birth to 3 program. He had some speech and motor delays when he was 2. Oh, come here, big guy. And we were able to access the programs that Birth to 3 had to offer. The current administration tried to cut these programs. In 2009, they tried to cut, or they did cut, over $500,000 from the state share of the program. In 2010, the current administration proposed cutting the state's contribution to the program entirely. This would have destroyed a program that is vital to so many parents and helping them prepare their children. Our Jack was a graduate of the Birth to 3 program. At 3 years old, he had gotten the services that he needed.